Good morning or good afternoon, everyone, and thank you for joining us here at the Global Heart Hub Inspire Advocacy Speaker Series. For some of you, it's morning, some of you maybe later morning, some of you afternoon, but in any case, we're delighted to have you with us. My name is Neil Johnson, and I'm representing the Global Heart Hub, who are the hosts of today's session. And in advance of proceeding, I would like to sincerely thank our industry partners in our advocacy development endeavors, Novartis, Vifor Pharma, Boehringer Ingelheim, and Servier. Just by way of, if I can get Jackie to move my slides for me here. Just by way of introduction to who we are, hopefully most of you at least have heard of us at this point. The Global Heart Hub is the first international alliance of heart patient organizations, in effect an umbrella organizations of heart patient organizations. And we're steadily growing our affiliations across the world. Currently we have patient organizations represented across 27 countries. We have over 60 patient organizations affiliated right now. And our mission, very simply, is to create or provide a platform for heart patient organizations to share their views, learn from each other's best practice, and unite on common advocacy goals. In terms of, next slide, Jackie. In terms of what we do, I guess the three key activities that we're currently engaged in is the organizing and amplifying of the patient and carer voice as key stakeholders in healthcare. We realize that in many other disease areas, patient organizations are organized, they're structured, they're connected. And for some strange reason, despite the burden of cardiovascular disease, this hasn't largely happened in our community. And this is one of the objectives of the Global Heart Hub, where we want to ensure that the patient voice is at the center of healthcare as a true and pivotal stakeholder. In our journey so far, what we have realized is that in the cardiovascular patient community, there are considerable deficits in terms of advocacy capability and capacity. And to this purpose, we are developing advocacy initiatives to help put patients at the center of healthcare policy. This bi-monthly webinar series, which we have now recently rebranded as the Inspire series, is one such example of this. And in the very name of Inspire, it is, as the name suggests, we want to put before you individuals, not just from the cardiovascular community, but individuals living with or caring for various chronic conditions who are in a position to show how their lived experience and how they've learned from their lived experience has been beneficial to the advocacy agenda. And as I mentioned earlier, we're here to try and develop the capacity and capability of our community through our Advocacy Academy. I would like to just flag to you today that this bi-monthly series, I think this is the 5th, if I'm not mistaken, and it's slowly building to what will be the first annual summit of the Global Heart Hub in different times, and perhaps in the future, or rather certainly in the future, the summit will be hopefully a face-to-face event. But on this occasion, it will be virtual, and the dates of our first annual summit will be the 5th and 6th of October this year, and the agenda and registration details will follow very shortly, but we can assure you we will have a stellar lineup of speakers. It will be an interactive session over 2 days, and we'd ask you to save the date and keep an eye out on the Global Heart Hub website for further details. Next slide. So today, we're absolutely delighted to have two outstanding speakers today, both of whom are female. And interestingly, they both come from the cardiovascular community. And they're going to be talking to us about what, believe it or not, is the #1 killer of women, cardiovascular disease. Despite perhaps common misconception, more women die from heart disease than breast cancer. Yet, for some reason, women and heart disease tends to be under, I guess, underexposed or under discussed topic. And we're delighted to have from WomenHeart USA two speakers today. Firstly, Amy Friedrich-Karnik, who is the Vice President of Advocacy and Communications at WomenHeart, and she'll be joined by Cecily Foster, who herself is somebody with lived experience of postpartum cardiomyopathy and a WomenHeart champion. And I'm hoping that we will learn from Amy more about what WomenHeart USA do in the area of advocacy, and then more specifically that we will hear from the discussion she has with Cecily how important it is to have the lived experience engaged in advocacy activity, and how being involved in WomenHeart and WomenHeart activities is a very empowering experience for the individual patient. So I'm going to hand you over now to Amy, and Amy, you're very welcome. We're delighted to have you. I'll hand the screen to you. I'll disappear, and I'll join you and Cecily later on for a question and answer session. Thank you indeed.
Great. Thank you, Neil, and thank you for that introduction. I think you set up the next hour that we're going to have together very nicely. As Neil said, I am Amy Friedrich-Karnik. I'm at WomenHeart. We're a patient-centered advocacy organization based in Washington, D.C. That works at the national level in the United States. And we've been around for over 20 years, and our goal is to provide support, education, and advocacy for women living with and at risk of heart disease. Our cornerstone, kind of the heart of our organization is, as Neil mentioned, our WomenHeart champions. And you will get to hear from Cecily a little bit later at the end of this talk. And these are women who are living with heart disease, who have gone through a rigorous training with faculty at the Mayo Clinic, a premier healthcare organization here in the United States. And they apply to become volunteer champions, and they go through several days of training, learning about how to tell their story, how to understand heart disease better, how to, they bond with one another, and they come out of the training and go back to their communities and really are our ambassadors on the ground. They run support networks for other women living with heart disease. They provide community education. And as you will hear a little bit more today, they engage in advocacy at the policy level. So what I'm going to do for the next half hour or so before we chat with Cecily is talk to you about, put a gender lens on heart disease, as Neil just said, and talk about why it's important to think about heart disease broadly as it affects all people and as it could impact all people, but specifically how it could impact women, and how this idea that people don't always recognize heart disease as something that impacts women, or at least not to the extent that it does, how that really impacts the lived experiences of women who are diagnosed with or trying to be diagnosed with heart disease. So we're going to start, next slide, with a poll with all of you, just to make sure you're all listening, and we'll pop it up on the screen. But I'm curious how many of your organizations in the work that you do consider sex and gender differences in your work on heart disease. Do you write about it? Do you program to it? You know, is it on the radar? So I'll give a second to just answer this question. Yes, you do, not really, and maybe sometimes. And then we'll see what the results are. And then Jackie, give people about 15 more seconds, and then we can see if you can share with me the results, or if you're able to pop them up on the screen. Okay, great. That is good. If you can all see, it's about almost exactly half do, and another 40% do sometimes. And so there's only a few that never consider it. So that is great to hear. So hopefully what I'll share with you today will give you some more information and tools and ways to think about and talk about heart disease as it impacts women. So next slide, let's talk about what we know. And what we know is that there are sex differences when it comes to heart disease. And this is really important to understand that, you know, the way that women may present age of onset, prognosis, all of these things, there are differences based in the science of heart disease and how it presents in men versus women. And that's important because it has implications for the way women experience their heart journey throughout their lives. And so we really need healthcare providers and clinicians and researchers to recognize, to understand, to name, and then to study those differences so that women can receive the best care possible. And it's also really important to recognize and name because we need women to understand that they are at risk for heart disease. They need to understand these prevalence numbers, that 1 in 3 women worldwide has a chance of suffering from a cardiovascular event. And they need to understand the symptoms because they need to understand when they need to seek care and be able to seek a diagnosis and care as early as possible if they are experiencing symptoms. And as you may know, a heart attack, for example, oftentimes we see represented in television or in the movies, especially here in the United States. It's often a man kind of clutching his chest and experiencing overwhelming pain and rush to the hospital, and it's a heart attack. And women may experience that the exact same way for sure, but oftentimes women experience it maybe a little bit differently. We hear from women all the time, and we know from the science that, they may experience a tightness in the chest, fatigue, nausea, kind of this gnawing pain, discomfort. And for some women, it can go on for hours, if not days, before they finally kind of think that something is bad enough that they go to seek care. And then we'll find out that they've been experiencing a heart attack for a number of hours. And so really raising that awareness, making sure women understand they're at risk is critically important. And there's also, when you put a gender lens on it, you realize there's a huge relationship to pregnancy. And so we know that, for lots of different reasons, as women tend to become older, we see a lot, we see older women now becoming pregnant, and they may bring with them into the pregnancy heart disease that needs to be managed alongside with the pregnancy. We also know that certain complications that women may experience during pregnancy, like preeclampsia, predispose them to being at greater risk of heart disease later in life. And so it's very important to understand that link and to communicate that to women so they can watch their heart health over the course of their life. We also know that heart conditions can develop during pregnancy. And so understanding those is very important so we can manage those. And just the basic fact that heart disease is the #1 medical cause of maternal mortality is really important. So when you put that gender lens on top of heart disease, all of these kinds of issues rise to the top and show that their importance. So next slide. Why does this matter? Why do we care? Why do we need to name it? Because as I said, it has implications for women's lives. Because we have this long history of not really recognizing heart disease in women in the same way that we do in men, we have a legacy that women have been underrepresented in the research. And so for many, many years, there was a lot less representation of women in our research, in our trials, and in what we know today about heart disease often comes from research that doesn't include women or includes them to a much smaller degree. And so we need to understand that. It is getting better, and through advocacy groups like ours and others around the world and in the United States, we do have much more participation and acknowledgement that we need more diversity in research and trials. The Journal of the American College of Cardiology did a kind of comprehensive study back in 2018 that looked at participation of women in clinical trials supporting FDA approval of cardiovascular drugs. That's here in the United States, looking at all those cardiovascular drugs that were moving through the process to get US approval to be on the market. That there had been an increase in better representation when it came to hypertension and atrial fibrillation. In particular, those drugs really did include a good representation of women, but we were still lacking in adequate representation when it came to trials related to coronary artery disease and heart failure specifically. So we definitely still have room for improvement. And the challenge is that when women are not included in the research, we don't know exactly if what we're prescribing or how we're treating is going to be the most and best effective way of treating heart disease for women. And it means that we don't have, the guidelines are not often sex specific. So providers are trying to kind of guess or navigate their way through how to treat women in some situations. Because the concerns related to side effects, efficacy, potential complications, if they're not included in the guidelines or if the research is not reported differentiating between men and women, there's just a lack of information. Another implication of this has to do with missed and delayed diagnosis. And we know that many women experience a delay in getting to the proper diagnosis because maybe in the beginning phases of their journey, their heart disease wasn't recognized. Either they didn't recognize it, providers didn't think about it. WomenHeart just completed a project over the last year that looked specifically at missed and delayed diagnosis. And we had a big convening where we brought folks together to discuss the problem, but also come up with solutions. So we have a new report that we just released that poses a whole series of potential research questions that if studied, we could get some real good evidence-based interventions that would help improve the situation of diagnosis and lead to more timely and accurate diagnosis of heart disease in women. We also know that it's important to name this because women need to be aware, like I said earlier, that it's their risk. Research that was done in the United States just recently looked at women's awareness of heart disease as their #1 killer and found that between 2009 and 2019, that awareness had decreased dramatically, unfortunately. So we had done a great job in the early 2000s of raising awareness that heart disease is a risk for women, that is something they experience. But clearly we haven't done a good enough job in the last 10 years. And we found that we went from 65% of women being aware in 2009 that heart disease was their #1 killer to 44% of women in the US being aware that heart disease was their #1 killer. And that decline happened across all different demographic groups, except for older women, 65 and older. They still exhibited a pretty high awareness. But below that age and amongst different populations, the awareness was low. And when people aren't aware, again, it makes prevention hard. When you're trying to reach out to folks and tell them to check their cholesterol, know their blood pressure, see a provider, get their heart health in order. If they don't see themselves as even being at risk, those messages are harder to penetrate. So we want to do something about this. We've been fighting on these issues for over 20 years. And our solution is to advocate for change. A big part of what we do is policy and advocacy. Next slide. So you can see here very briefly the types of policies that we engage at. For WomenHeart, we engage at our national federal level. So we engage with Congress on a lot of these policies. We don't necessarily engage in individual states in our 50 states, but we do train women to be able to do that. So the types of issues that we look at, as you can see here, we care greatly, obviously, about access. In the United States, you probably are aware, we don't, not everyone is guaranteed healthcare. So it's a lot of work on the policy front to make sure that everybody does have access to affordable quality health coverage. And so it's something that we fight for often. And we know women in particular are more likely to be low income and more likely to be uninsured. Which means they have a lot less access to being able to see a provider if they're feeling something wrong. So we fight for that issue. You may not be surprised because of this lack of awareness that the way heart disease impacts women. Women are less likely to be referred for cardiac rehabilitation, which we know works really well after someone has experienced a diagnosis. So we fight to make sure women have full access and can afford cardiac rehab. Again, participation in clinical trials, like I spoke about. We do advocacy for federal funding to make sure that we have the research dollars needed through our national healthcare systems, our National Institutes of Health, and our Centers for Disease Control and Prevention, to make sure that we have programs and research dollars going towards women and heart disease. And we do advocacy around maternal health for the reasons that I talked about. So this just gives you a smattering of some of the policy issues that we are working on. We have our second poll that we'll do right now, our second and final poll, just to see. I'm going to talk a little bit about how we engage patients in advocacy, but I'm curious from your organizations if you engage in policy, if you have that capacity, or if engaging with elected officials or in some way impacting change on a more macro scale is something that you do. So we'll leave this poll up for just a second to see if you engage in advocacy. And then again, we'll also see the results. Okay, good. That's a pretty high number as well. Like before, it looks like it's just over half of you, or about half, do engage in advocacy. And another small group do sometimes. So it's definitely an area of work that I know is, it takes capacity, and it takes the right staff or the right volunteers to be able to engage. But it's very important. So I'm glad to see that so many of you are engaged. So next slide. Again, I want to spend some time before we talk to Cecily about talking about how WomenHeart engages patients, because this has been the core of who we are from the beginning. Because as you all know, no matter what we do, whether we're engaging in advocacy or patient support or education, at the end of the day, all of the work that we do is to help people and to make sure that people who don't feel well are feeling better. We want their lives to be better. We want them to be healthier. And we are all engaged in that work to make sure their lives are better. And so if we're going to do that work, and if we're going to engage in policy, we need to make sure that the lived experiences of the people who experience heart disease are being listened to. We want to make sure that patients are informing the policy agenda, that they're informing the messages that we get, that they're informing the solutions. And so doing that takes time and takes effort, but it's so critically important. And it also helps with results. We know that, at least here in the United States, and I'm sure in many countries around the world, those who are elected listen to the people who vote for them, and or they should be. And so we know that patients can have a very strong voice and be very effective when given the right tools to be able to tell their stories to elected officials. And so that's what we try to do, is we try to support patients to be storytellers, because as professionals at WomenHeart and at other patient organizations, when we engage with policymakers, we're often trying to find solutions to problems. And policymakers want to introduce bills and propose policies that solve a problem. And so hearing from patients the challenges they're facing, the places where they're maybe experiencing injustice or a lack of access, those are the problems that we want to take to our elected officials and then help to craft those solutions. And so the stories that patients have to tell are incredibly valuable and can be incredibly impactful, because politicians will listen, and there is a space. And when patients act collectively, their voice can really impact the outcomes. And so our job is to make sure that we bring those voices forward. And you can see here on the slide, there's a picture on the bottom of Cecily speaking at a Hill briefing, which is speaking to members of Congress and their staff about her experience with heart disease. And then in that top picture you have there, Cecily, you have our CEO. In pink, you have a congresswoman from Illinois who is leading legislation around maternal health and its impact with heart disease. And then on the right, you have Dr. Gibbons, who is leads our National Heart, Lung, and Blood Institute here in the United States as part of the National Institutes of Health. So, this is kind of the pinnacle kind of event that we hope champions will be able to participate in, is coming and really telling their story to people who have an opportunity to make an impact. So next slide. As I said, we want to make sure patients' voices are at the center of what we do. So earlier this year, we did a survey of women living with heart disease. And so we pushed it organically as far as we could. And so this represents, we were able to receive 155 responses from women who are living with heart disease. Just about 2/3 of those were our WomenHeart champions. So you have to take our results knowing that the majority of people who responded are trained, motivated volunteers who have self-selected to participate in our programs. But another 30% are just regular women living with heart disease in the United States. And what we wanted to understand from them in this survey is both their experiences living with heart disease, but also their interest in advocacy. What are the issues they care about? What are the problems they want to see solved? And how motivated or interested are they in engaging as patient advocates? So as you can see here is probably a self-selection of folks who took the survey, but almost all are interested in policy issues. So I think if you choose to engage in this space at home where you're doing your work, you might be surprised at the high level of interest you get from patients and wanting to be able to engage in some way in impacting change. And many of our survey respondents have engaged in some way, shape, or form, whether that was just writing a letter at some point to their elected official, or telling their story, or talking to the media perhaps to tell their story. And many really would appreciate the opportunities to engage. So that's what we're here for at WomenHeart, is to give them those opportunities. Next slide. And you can see here what they care about. So we gave a whole list of issues that are relevant in the United States and probably other places, to see what are the issues that women with heart disease want to see addressed at the policy level. And maybe not surprising, over half wanted to see prevention really focused on. And people were able to select more than one, up to 3 options. So these top 3 that people cared about a lot are things you already heard me talk about: prevention, delayed diagnosis, access to cardiac rehab and services. But there was at least, almost a third of people were interested in this whole host of issues: funding for research, representation in trials, addressing disparities, which is something that WomenHeart continues to do and is trying to do better, is looking at those disparities for women of color in the United States when it comes to diagnosis and care and treatment. But the whole host, it shows you there's a lot of issues that could be worked on and a lot of interest in across the board. So next slide. What we've done is last year we launched what's called Advocacy Core. WomenHeart has always engaged our champions in telling their stories and talking to elected officials. But last year we made it a little more official, and we established a full program with funding and with staffing to support WomenHeart champions. And our goal was twofold. It's both to empower and engage and build the skills of our champions, so they can take those skills and run with it and do advocacy, with our support, but also if they wanted to on their own, and just have that empowerment and knowledge to be able to fight for change. And we also wanted to develop a group of advocates for ourselves who could help advance these policies and inform these policy solutions, and have a core of folks that we could call on to engage in that way. And so next slide, we asked them in one of the first meetings. So the way it works is we have our WomenHeart champions. We have, over the years, we've trained almost 1,000 champions. In that core, it changes every year how many are active, but we invited those champions who are already engaged in either community education or leading support networks to also kind of add to their list of activities being engaged in Advocacy Core. And so we have about 50 women who signed up. And at the first or second meeting, I asked, just informally in a poll like this, what are you most looking forward to? Why did you sign up? As you can see here, what I think is true for so many patients who've experienced a healthcare journey is they want to make an impact, and they want their experience to mean something, and they want to be part of change. And so that's what we really tried to tap into. And a lot of them did want to learn the specifics of the policy process, and wanted to have opportunities to tell their story to lawmakers to impact change. So this was just a quick poll of folks who were at our meeting that day to understand what their motivation is. Next slide. And so what we do, and this is what I think is helpful for all of you if you want to start engaging in this way more deeply, is it does take an investment, and it takes an investment in training and support for patients to really give them the confidence and the tools and the opportunities they need to effectively engage. Once you do that, they will do the work. They have the stories to tell, and they are very impactful at being able to do that. But getting to that place of sitting in the office with a lawmaker or writing the letter takes some support. So we do webinars and trainings on the legislative process, speaking specifically about how and when patient advocates can be most impactful. We created tools. We have a legislative toolkit. We have fact sheets with talking points, all these things that then, patients can go into a meeting or sit down to write a letter, and they'll have something at their fingertips to kind of help them express what they want to say. And we do a lot of calls to action over email, where people can just click and send a message to their lawmaker advocating for specific policies. So we work hard to continually offer those types of tools and training so that patients have what they need to be able to go forth and affect change in the way that they hope to be able to do so. So with that, I think we'll turn it over now to engaging in a conversation with Cecily, who is a WomenHeart champion. She has been since 2018. So she went through the training that I talked about. She has been an incredibly effective advocate for WomenHeart and has told her story on the local news and at events. And as you saw in Washington, DC. So we're just going to engage in a quick conversation here so you guys can learn more about her and her experience doing advocacy. And then we'll turn to questions after that. But first, Cecily, thank you so much for joining us today.
Hi, Amy. Thank you.
Hi. And I thought if you could just start a little bit and just to ground people, can you just tell us your heart story, kind of what's been your experience with heart disease?
Yeah, so in 2007, I was pregnant with my second child, and within probably about my 36th week of pregnancy, I was experiencing preeclampsia. They rushed me to the hospital. Thank goodness I didn't have to have a C-section. She did actually come that evening. But I stayed in the hospital maybe about 2 or 3 days beyond the length of time typically you would stay in a hospital after birth. By the time I went home maybe on a Wednesday. By that Sunday, I was feeling what I thought was just my breast milk coming in, but it was a slight pain. And I called my nurse, and she told me to go to she made me an appointment to go to the doctor. And she called me back within 15 minutes and said, go straight to the emergency room. And I wasn't sure what was going on. This is my second child. Like, I'm a pro. I know how to do this. And so when I got there, they ran some tests and they told me that I was in heart failure. And being in healthcare now for 13 years, I understood what they were telling me, but I didn't understand what they were telling me. I couldn't understand that. I didn't know what went wrong. At what point did this happen? What did I do? How did this happen? I was totally healthy prior to my pregnancy, during my pregnancy, except for the last couple of weeks. And, that diagnosis was heart-wrenching, especially having a new baby that I really couldn't take care of. I was lethargic. I really couldn't do anything. I was so thankful that my husband was there to help and assist me in tending to my baby because I couldn't. And this actually lasted for anywhere from 4 to 5 years worth of just it went from the physical of not being able to do what I was typically able to do for a person my age. But then also it was the mental. There was the mental part of it, the constant fear of the possibility, am I going to die? I want to stress that in my case, because I didn't have a point of what I consider reference, right? So I didn't have a heart attack. I didn't pass out. I didn't lose consciousness. There was nothing that I could actually reflect to say, okay, if this was to happen again, this is what it felt like. Or if this is what happened again, this is what it looked like. I didn't have that. So therefore, my daily experience was, if anything I felt, was this it again? I didn't know. And that itself was traumatizing. It was so traumatizing. I went back to work after 8 weeks, but I pushed through, and it was really, really hard. It was difficult to get through. And I managed, it took me, again, I would say anywhere from 5 to 6 years to be able to get to a place where I was physically and mentally whole again at that point. So it was a really rough journey.
That's a journey. Did anyone even utter the words heart disease to you, especially when you were diagnosed with preeclampsia? Was heart disease even a thing that maybe was on your radar as a possibility in your future life at all?
Absolutely not.
No.
Absolutely not. Nothing. No history of heart disease in my family. Nothing, no high blood pressure, nothing at all. Nothing at all.
And did you get, were you referred to cardiac rehab? And once you were, sufficiently past the postpartum weeks, were you offered cardiac rehab at all in those first couple of years to kind of help physically and emotionally get to a healthier place?
No, I wasn't. I wasn't offered that. I didn't learn about cardiac rehab until I went to the WomenHeart training. And so we went through an extensive training, a lot of great information. And one of the sessions that we had is that we actually went to a rehab facility. And so as I was listening to the ladies in my group talk about, rehab and what a great experience it was for them. And these ladies, may I say, these ladies either had heart transplants. So I say that to say that it was their situation, I would say, compared to mine, was a little bit more life-threatening because they had a heart transplant. But their story, when they told their story, they mentioned that they recovered within 5 weeks. And so as I say to you that it took me 5 to 6 years for my recovery, what if I had that cardiac rehab? What if I was offered that? What if I was given that? Maybe I would not have to go through all of the pain, mental and physical, that I went through had I was offered cardiac rehab. I couldn't wait until the session was over at the Mayo Clinic, because I literally ran back home, made an appointment with my cardiologist, looked him right in the face and say, "Why didn't you send me to cardiac rehab?" Very boldly, and I needed an answer. I needed an answer. I didn't understand. When I found out about cardiac rehab from the ladies, I literally went back to my hotel and cried my eyes out because I didn't know, and no one told me. No one gave me an opportunity. No one gave me an opportunity to make a decision. I didn't know about it. And so my doctor's response was exactly this. You were young. We thought you were going to bounce back. I never considered cardiac rehab for you. That was his response.
So talk about, you mentioned coming to the symposium. What drew you to WomenHeart, and what was kind of your motivation for applying and wanting to become engaged as a champion and volunteer?
So I saw an advertisement on Facebook and I thought it was interesting. I really had no idea what to expect other than the information that was given to me of what what was going to go on during the agenda, but I can honestly say it was a life-changing experience. It really was a life-changing experience. And the reason why is that when I went, so my episode started in 2007. That's when I gave birth to my daughter. I didn't join WomenHeart until 2018. So during that time, as things got better with me physically and mentally, I thought I was okay. Until I went to WomenHeart. And what WomenHeart did is it connected me with women that actually understood what I was going through. I didn't have that. I didn't have anybody. I'm thankful I had my family, my husband, my kids, my support group locally, but they could not understand what I was going through. They didn't understand being on Lasix and having to, step away every 5 minutes because you have to take your Lasix. They understood that. We shared stories, we laughed, we cried. And it literally was, it was therapeutic. It really was therapeutic to be able to have that. And that's why I think it's so important for having groups of advocacy, because now that it was such an impact for me, I want to be able to have that impact and let someone else know, it's okay. I hear you and I understand you outside of your family members for what you're going through.
So that's amazing. And that's what we hear often from our champions is they meet heart sisters and they get this different kinds of support, and you all go home and you give that support to the women in your community and the education, and it's amazing. But you've gone even further, and you have told your story outside of just supporting the women in your community. You've chosen to engage in this advocacy space. So can you tell us a little bit about what it was like coming to Washington? Those pictures, we were reflecting the other day, those pictures took place at the very beginning of 2020, right before the world shut down. Luckily, we were all safe.
Yes.
Talk about what it was like. You live a couple hours away in Virginia, so you drove up, but talk about that experience of coming to Capitol Hill and meeting the congresswomen and speaking to lawmakers and telling them your story. What motivated you to do that, and what was that like?
Right. That right there is the ultimate. To have people who are in a position to make a change, to support your vision and the things that you want to do or see happen in healthcare with women and heart disease. It was a great experience. I also think it was an opportunity for me to learn. When I was listening to the other physicians and other speakers, I learned things that I had no idea. And during that session, it actually put a pinpoint to why, as you asked, did I have anything, any other symptoms, or did I know about heart disease prior to my diagnosis? It kind of gave me an understanding that my diagnosis could very well have been more of a viral thing that lay dormant within me, and it just came out during my pregnancy, which I've learned throughout the years that can happen. So it wasn't nothing that I did to myself or any outside things, but it was very, very impactful, and I'm glad I had the opportunity to share my story there.
Great. And as you know, we want, for those of us who do advocacy, we want to take advantage when we have patients meeting with lawmakers to get the fullness out of you for the day. So not only did you speak at a briefing to an audience of staff and members of Congress, but then we went and met with your member of Congress who represents you. And I know you met with a staffer and talked about your story. Why did you take anything away from that? Or why did you think it was important to have that one-on-one meeting with the person in your district and tell your story to that person?
Yeah, so that was important to me, because now, there's always different stages, right, of people that you can have contact with. And the importance of that is that they understood where locally, where I was coming from. They understood, where my connections are, my affiliations with the hospital system that I work for. So I think that being able to talk to someone like that, there was a deeper connection. It wasn't just, here's someone talking about something, here's specific reasons that they can actually understand where I'm coming from and what exactly I'm talking about. So that was also a great experience.
Great. And then before we go to questions from the audience, I want to ask what advice you would have for the organizations that are on the phone here today, if they're thinking about deepening their engagement work and policy, or stepping into the advocacy space. Do you have any advice for them about what you would say they should do as they engage patients?
So you definitely want to find patients who really, really are invested in, trying to help and support others. I think that's number one. Also, to be able to provide support in terms of education, additional information, keeping them involved. Sometimes it's a little difficult because we don't have the connections that the organizations might have. So making sure that you filter down that information of new legislators, new bills that's going on, so that we can also be in the loop of what's going on, so we can share that information and education with the people on the outside that we're helping and supporting.
Great, thank you.
Excellent.
Thank you,
Excellent.
Cecily. And I'm going to hand it over to Neil to moderate our questions now.
Thank you, Amy, and thank you, Cecily. And as I said at the outset, we call this our advocacy, our Inspire Advocacy Series. And as the word inspire suggests, we're using these sessions to inspire others. And what greater inspiration could we get than hearing from both of you today? So thank you very much. A really, really valuable presentation. I have so many questions, and I now need to try and scramble and put them into some sort of logical order, and all within 15 minutes. Maybe start with maybe just a comment first of all, Cecily. I think, and it is actually in some of the questions around cardiac rehab, it is quite disturbing that in the case of cardiovascular disease, where cardiac rehab is an established and necessary part of recovery, that actually access to rehab clearly sometimes access is because people haven't signposted it, but in some countries access is down to lack of resources. But I think, you know, your experience, the psychological trauma you described, taking 5 to 6 years to recover from, could have been so much better handled had you had the opportunity for rehab. So I think it's a really strong example of how you know, we really need to prioritize cardiac rehab for those recovering from cardiac events. To maybe start with you, Amy. Big emphasis, I guess, from this presentation is on the shared experience and telling stories. But as we know, advocacy is more than telling stories. We're telling the story to bring about some change. And just as an organization, WomenHeart, and you've shared some of your sort of policy objectives, and putting myself into the seat of perhaps many of the people listening to this today who are maybe in smaller organizations and are coming at this and thinking, oh, wow, you know, this is a big ask that I'm going to potentially, you know, change a law or contribute to, you know, introducing a law or something as big as that. Can you just talk a little bit about, or maybe simplify it, if you will, how telling the story can be effectively used, and how you as an organization even begin to prioritize what pieces of policy you want to change, and then some of the basic steps to bringing these changes about, or creating a policy, if that's the case.
Yeah, no, that's a really important question. Sometimes it's very authentic. Sometimes you hear a story and it speaks to something, and if you're already engaged as an organization in the policy space, or you just have that motivation, it points to a clear solution, and then you kind of have to map out over the next months, years, how do we get to a solution? More realistically, what often happens is there are policy issues that swirl and just become kind of key policy issues in your country, in your state, in your context. You know, for example, in the United States, obviously I mentioned coverage. And, you know, we passed what we call the Affordable Care Act well over 10 years ago, but that is just a natural policy issue that is always discussed and always at the forefront in Congress in the United States. So what we do, instead of trying to just create solutions out of thin air, is insert ourselves into current policy discussions and find ways to think, okay, we know women with heart disease may experience this, or there's a solution. How can we insert ourselves more easily into a discussion that's already happening? I would say the same thing is happening with maternal health. In the United States, we know that Black women experience much higher rates of maternal mortality than white women. And so it's become a very big and relevant policy discussion. So instead of just leading a movement on our own, we are inserting ourselves and figuring, okay, there's solutions that are marching forward. How can we make sure our issue is recognized in those solutions? And then how can we find the stories to back up what we think we know to be the case? And then you find the stories and you kind of insert them. And also in the US context, and I'm sure in other places, working in coalition is the only way any of this gets done. So all of the issues that we work on, I can name 5, 10, 20 other organizations that are fighting for the same thing. And so what we do is our work together. And so when we're fighting for, and that's both gives you more political power, but also we are also a small organization with not a lot of staff. So I rely heavily on colleagues in other organizations to do analysis of legislation, and they share that with the rest of us, or to draft letters that we sign on to as a large group. So don't think that you need to kind of do it all alone. You don't have to, as an organization, write the bills and do the advocacy and bring the stories. Often our role is to bring the story. Our partner organizations are analyzing bills. We've decided there's a way for us to have an impact. And then they turn to groups like ours that have access to patients, and we bring the stories, but we're working together on the collective effort, the strategy and all of that. So that relying on group, and like Global Heart Hub, right? We're a coalition of all these groups that, that can go down and down to your local level. But, and then the last thing we have to do a lot is figure out where our value add is. We are small, and so we choose to engage in policies that really do have an impact on women, where we have a unique voice and perspective to bring that perhaps other groups don't, and where we have capacity. So there are certain policies, let's say around tobacco cessation, that is obviously smoking is linked to heart disease and smoking is bad. We don't have capacity nor a unique angle to bring, so we let other groups take that policy issue, and we might choose to lead on the maternal health piece, for example. So finding those policies that fit your particular organization, finding groups that can engage with you on that, finding stories to help, and knowing that it's a long haul. Policy change takes years. So figuring out a work plan that really allows you to invest over the long term.
So just to pick up on something there, as an organization, as you say there, do you adopt a broad brush approach and try and look at all that's happening in cardiovascular health policy? Or do you internally as an organization prioritize, okay, we're clearly looking at heart disease from a female lens perspective, and do you then rank order, or how do you decide what things you're going to really put your energy behind? And maybe can you give an example of something where you've achieved something very tangible? So two-pronged question there.
Yeah, so we definitely do. I mean, we keep our eyes on the entire policy landscape, and then we definitely make decisions internally about what to focus on. And so the tobacco one is an example, very important. We've just decided we can't engage on that only because of capacity. So I don't follow those bills. I don't engage in that space because we really have had to make hard decisions, and we reevaluate every year or two, what are those lists of policy issue areas informed by champions' needs. I mean, I would say cardiac rehab is definitely a place where the policy is, very specific. It's not like big flashy policy issue, but access to cardiac rehab is so important to our population. So we've chosen to really engage in that space with a lot of time and effort, because it's so needed. And there's bills moving forward in that regard. I would say the space where we've had the most impact over the years is around participation in clinical trials. And that is because WomenHeart and maybe one or two other groups made that a very unique focus, because other groups weren't necessarily talking about it. And it had such a unique impact on women not being included. So lots of bills were passed a few years ago that make sure women have to now be included, and people of color have to be included in trials, and those that reported out. But yes, it's a lot of internal discussions to make those decisions. Okay.
So, and not to labor the point, but if we take something like cardiac rehab, so right across the full cardiovascular spectrum, male, female, there's an issue around access, availability, and I guess prioritization of cardiac rehab. So let's take WomenHeart. Would you, for example, when you talk about access, would you be very specific and say, okay, our objective here is to ensure that in any cardiac rehab program, there must be, equal access for men or women, or equal proportion? Or how specific, and how do you break it down and set your targets?
So we aren't that specific in like the rules of the policies we're going for. Yep. There's a bill right now that would isn't specific to women, but there's a policy moving forward in Congress that would within our Medicare program for older adults allow more advanced practice clinicians, for example, to prescribe cardiac rehab as opposed to just doctors. So we're fighting for that. That is not unique to women, but we know that if that were to pass, it would open up the doors to more people being referred. So that's a specific policy we're working on. And And what we would do is that we would make sure that every letter we write to Capitol Hill advocating for that policy includes the impact on women. So that's what we're doing. We're bringing to bear how this policy would impact women, even though across the board it would impact others. And when we speak in coalition and we think about other solutions, we are bringing to bear in those conversations the unique experiences of women. So the policy we end up fighting for may be specific to women, but it may be broad, but it's been informed by the experiences that women have. And so we're going to fight to make sure that those informed experiences come to bear.
Okay. So sort of in a related way, if I can go to you, Cecily, we heard your story and thank you really so much for sharing that. Can I ask you, was the gender piece important in terms of your decision to sort of take up the mantle to share your story and to potentially get engaged in advocacy? Were you conscious of this gender disparity in women and heart disease, or was it heart disease per se, and that you were somebody who has lived experience and you've identified needs, as it were?
I don't think that prior to joining WomenHeart, I wasn't aware that there was a concern or an issue. As I joined and I partake in different functions and exercises and did my own research, that's when my eyes were open that, yeah, there is a gender issue as it pertains to heart disease.
Okay. I have so many questions. We could go on for hours. If I can quickly maybe scan through some of these and get quick responses from you. Pauline actually has asked a question around, I guess it's to do with your organizational capacity. And she's wondering how many patients are employed in WomenHeart, or is it run with volunteer patient participation? So in terms of the work you do, like how much of it is staff, how much of it is volunteers? Just a quick
yes.
response to that, yeah.
So all of our patients are volunteers. We are a very small staff of about 5 or 6 people with a couple of consultants. And then we have hundreds of champions who are doing volunteer work on the ground. So our staff are paid and manage that volunteer corps with opportunities, but all of the patients are volunteers.
Okay. John has talked about his 89-year-old aunt who's going into cardiac rehab today and was stunned to hear of the lack of availability. Caroline is asking, is it possible to access the tools and training that you guys provide from outside of the US, or is it, yeah?
Yep, we have some toolkits and things that are all in PDF format that I'm happy to share with you, Neil, that you can share out with the
Fantastic.
community.
And as I said to you before we started the webinar, it's something that the Global Heart Hub is now looking at, is setting up a special group within the cardiac community, international group. So we could maybe come back and talk about that again. Susan is asking, it might be too long a question to answer, but maybe a quick insight. Cecily, maybe I could throw this to you. Why do you think awareness among women is low in terms of heart disease? And why is it that you had to sort of research this to find out about the gender disparity? Do you have any thoughts on that?
Lack of knowledge, lack of understanding of what's out there, what the issues are with people. Maybe, not communicating within your own families and explaining, what your medical issues are, to realize, hey, I might have, 6 women in my family that have experienced heart disease. So the conversation needs to go on within families and then outside in the community.
It's a great answer. Thank you for that. And I'm just trying to see, can I, we're really pushing it against the clock here. Can I take maybe one more question? Back to the advocacy piece, and the training that WomenHeart provide. What motivated WomenHeart to put a formal training process in place, Amy? Does it go back to what I mentioned at the outset, that in this space we're working in the cardiovascular community, that sort of skill set is lacking, or what was your thinking behind it?
Yeah, I would say it wasn't so much. I mean, within our Women Heart Champion population, there's actually a lot of folks, women who have been engaging in advocacy. So for us, it was a little bit more about organizing them together and having some stories and more in a more organized format. We have a very good system of collecting their heart stories. So when we need a woman with heart failure to do a campaign, or a woman with AFib, or we can find them pretty easily. We collect that from them and we work with them on that. But in the advocacy space, if we needed a woman who had experienced lack of access to cardiac rehab, or didn't have insurance for a few years, or those kinds of experiences, we didn't have at our fingertips, but all of the women had stories about what they cared about or what they experienced. So it was more of an effort to make sure that everyone in our champion corps had the tools and skills, and that we had the information about them, and that we could really be more effective with policymakers. So if they called and said, hey, we need a story about this, I knew who to turn to, because we've collected that. And then also really giving women an extra opportunity to really engage deeper. And so formalizing it allowed us to get funding and really develop those tools.
Very good. I'm afraid the time has come against us. It's hard to believe that an hour has passed so quickly. Can I say to both of you, thank you sincerely, first of all, for giving your time today. You've allowed us share, put a spotlight on a very important issue, which is the gender differences in cardiovascular health. And then equally the importance of the lived experience, telling the story and playing a role in advocacy. I'd like to thank all those who joined us today. I'm conscious that we're in the middle of the summer vacation. It's great to see people joining us in such large numbers. To remind you again that this is a bi-monthly Inspire series, advocacy series. And because our first inaugural Unite Congress will happen in October, the next get together, if you will be that October 2-day event. And we will certainly communicate with all of those of you who have been engaged with us in the recent months, and keep an eye out on the Global Heart Hub website for further information. In the interest of time, I'm going to cut it there. Thank you so much, Amy. Really appreciate engaging with WomenHeart and working with you on this. And Cecily, great to hear you, your story, and thank you so much for sharing it. It's been very, very powerful and inspirational. And with that, I think we'll say goodbye to everybody, and thanks all of those who've joined us today. Thank you.